So my first question is for Dr. Amy. Didn't I hit you up on Grindr last night? Anywho. Hi, my name is Josh. I'm a healthcare worker and queer activist and consider myself to be pretty well informed and connected. And yet, had you asked me about PrEP as recently as September, I would have wondered what you were talking about. And I'm up here because I feel that the word PrEP needs to be on the lips of everyone who is sexually active and the people they love. So, Dr. Amy covered what PrEP is, the pre-exposure prophylaxis. It's a very easy once-a-day drug that kills HIV before it can infect you if you are exposed to it. So, being newly single after 5 years and being sexually active, this naturally piqued my interest. You know, if a once-a-day pill can help prevent an unwanted condition, why wouldn't you take it? But for good measure, I reached out to where all good arguments take place, social media. And the results were somewhat not surprising, but they're worth teasing out. Two people who, you know, are my friends reached out to me privately to tell their stories, which were well received and appreciated, but I wonder why wouldn't they feel safe to say publicly that they were PrEP users, until I considered the other responses that I received, most of which were positive. But there was a strong current of people who were telling me that if I weren't being, you know, their word sleazy, I wouldn't have to worry about this, or that they felt that this pill would encourage bad behavior. These lines of thought are nothing new. You know, 54 years after the release of the birth control pill, and 41 years after safe and legal abortion became the law of the land, people are still saying that contraceptives will encourage bad behavior. But I have news for them. Bad behavior does not need to be encouraged. And furthermore, there's nothing bad, dirty, or shameful about sex. We owe it to ourselves, our partners, and the people we love to first and foremost enjoy ourselves and to do all that we can to protect ourselves and others. We as a society need to come to grips with the fact that sex-positive and queer-inclusive sex education is not part of the fact that this is not part of our public education system is nothing short of a public health crisis. Creating a layer of young people with lots of misinformation and questions and afraid to seek out answers for fear of judgment. And this is dangerous. Silence literally equals death in this case, to borrow a phrase from ACTA. I, along with my doctor, Dr. Chan, thank you, did decide that going on PrEP was the right decision for the type of life I lead. I was very fortunate to thus far not experience any of the side effects that people often do, you know, the nausea, vomiting, and all that. And if you're wondering, it didn't encourage any more or less bad behavior. To conclude, I feel that I'd be remiss if I did not discuss how equally important access to this drug is to its availability. I'm very lucky in that I have a good job with good health insurance, so access to PrEP was no issue to me. But there are so many people in vulnerable populations, and I'm thinking especially of sex workers, of IV drug users who don't have jobs or health insurance, who could not afford to pay the upwards of $1,500 for a monthly supply of PrEP out of pocket. PrEP has the potential to make new HIV infections a thing of the past, but if it cannot do that if no one's ever heard of it, and the people who need it the most cannot access it. These are the facts, but our challenge as healthcare providers, lawmakers, activists, and people who want to see a world without HIV/AIDS is to overcome them. We have come so far already. Research in tandem with activism has taken HIV infection to a death sentence to what is mostly a manageable chronic condition. Mostly. It still sucks. And we have the capability now to prevent it in the first place. So we need to be screaming about this from rooftops. flyering every gay bar, and yes, talking to Grindr and Scruff and Manhunt or whatever else gay people used to hook up. And the phrase, ask your doctor about PrEP, should be as recognizable as a slogan as get tested and know your status. So I'll leave you with that. Thank you.